Oral thrush, symptoms, causes, treatments. Oral thrush, also known as oral candidiasis, is a mouth ailment caused by a fungal infection that can affect both adults and children. The illness, which develops on the mucous membranes that line the inside of the mouth, is typically harmless to individuals who live a healthy lifestyle. Oral thrush can affect people of any age, although it is more common in people who have weakened immune systems. Babies and the elderly, as well as those with weakened immune systems, are particularly vulnerable. Symptoms may not appear in the early stages of infection in certain situations. Signs and symptoms of oral thrush include tongue, roof of mouth, gums, tonsils, and inner cheeks have creamy white lesions. Redness, burning, or soreness or mouth and tongue. Redness and cracking around the mouth's corners. Loss of taste. A cotton-like sensation in the mouth. Difficulties swallowing or eating. Oral thrush is caused by a fungus, usually Candida albicans. Candida is a natural organism in your mouth that can turn into an infection if it becomes too vast. Several factors contribute to the fungal overgrowth that leads to infections such as an immune system that is weakened or inhibited, diabetes that is untreated or poorly managed. Antibiotics, prednisone, and inhaled corticosteroids are examples of medications that disrupt the normal balance of bacteria in your body. Suffering from dry mouth. Improper denture care. Breastfeeding mothers are more likely to get oral thrush from their newborns. Check your child's mouth and surrounding areas for any lesions and contact your dentist if detected. Oral thrush is usually not a problem for healthy people and children. However, if left untreated, the infection can spread and cause significant health problems. To help decrease your chance of illness, take a few easy precautions to protect yourself and your family. Brush teeth at least twice a day. Make it a habit to see your dentist on a regular basis. Sugary meals should be consumed in moderation. If you have diabetes, keep your blood sugar levels in check. After taking some medicines, rinse your mouth. Use a mouthwash intended to help with moisture to alleviate dry mouth problems. Remove your dentures every night, clean them every day, and make sure they fit properly. It might be difficult to get your child to brush, but they must brush and floss twice daily to avoid oral thrush from becoming more serious. Treatments for oral thrush include brushing and flossing on a regular basis can assist, as can toothpastes packed with bad breath-fighting chemicals and complete plaque removal characteristics. Replace your brush head every 3 months, or as soon as you notice any indications of infection. Toothbrushes should not be shared with others. Make sure your dentures are clean by asking your dentist about disinfection solutions that are right for you. Make a saltwater rinse by combining half a teaspoon of salt with 1 cup of warm water. If you have a recurring or persistent oral thrush infection, make an appointment with your dentist immediately. Be sure to like, subscribe, and hit the notification bell to get more videos like this one.